Welcome to Marina Hills Animal Hospital staff meeting. Today we're going to talk about something that is that's difficult, but it's important that we do well, and that is euthanasia. Now this is for my staff. Some folks on the internet may see this as well, and you're of course welcome to hear what we think can do for euthanasia, but primarily this conversation is for you guys, okay? The first thing is I want you to know that it is the doctor's responsibility in consultation with the client to make the decision about when pets are going to be euthanized. It's not the doctor on their own, it's not the client on their own, and it's never you. Okay, so you don't have the burden of deciding when pets are going to be euthanized. You also don't have the responsibility of having to do it, because I won't put that on you guys. And so what comes out of that is, if a client calls and says, I want to euthanize my pet, your answer is, I'd be glad for you to meet with the doctor and determine if that seems appropriate for your pet. Okay? You're not allowed to take a drop off that says, here's your pet, someone wants you to euthanize it, go at it, doc. That's not going to happen. Okay? It's very important. Because we want to make sure that clients are well informed, that the medical situation is appropriate, and that we're really watching out for everyone's best interest. And that's a very personal decision. I wouldn't ask Dr. Peisel to euthanize an animal she'd never seen or examined. Dr. Stevens isn't going to schedule a euthanasia for me. It's a decision that I make as a doctor based on the client and the pet and the whole situation. Okay? So that's important, scheduling comment. So that you are well informed about what's going on, because it's done with the doctor, you guys are often not in the room. I want you to know the conversation I have with clients when we are performing euthanasia. The first, of course, is we start with a physical exam and determine what physical condition is the concern, what the story is, what the situation is, because that matters. The living arrangements, the stress, the health issues involved are all part of the decision when it's appropriate to euthanize or not. And there are times where clients are relieved to find out that there are steps that can be taken. There are ways that we can extend quality of life. And so sometimes when a client thinks that euthanasia is the next step, it's not always the next step. And so that's something that we work through together, the doctors with the client. When it seems appropriate to me, the conversation I have with clients goes like this. The first thing we always have to consider is the moral question. Is it appropriate to take an animal's life? And if you ask different people, you're going to get different answers to that question. My opinion is that we people are stewards of animals, which means we have the responsibility to care for every aspect of their lives. And when it's appropriate, that we are in a position to take their lives. And that's a moral question. And you can ask different people and find different opinions, but here at Marina Hills, that's my opinion, and that's what I share with my clients. The next question is, what are the details? When we're euthanizing pets, what exactly is going on? The first thing is some paperwork that we always need to have taken care of first, and that is twofold. One, that the person presenting the pet is in fact the owner of the pet or the authorized agent of the owner. It's really important that we know who we're talking to and that they are the right person to be making decisions about euthanasia. The second is the form we have them sign says that the pet has not bitten any people within 14 days. And that has everything to do with rabies quarantine laws, it's state law in the state of California, that pets that have bitten someone have to be managed differently than pets who have not bitten somebody before they're euthanized. And so we always make sure that everyone's clear that a pet has not bitten anyone within 2 weeks. If the pet has bitten someone, then there's a whole different kind of conversation we need to have about history and quarantine and rabies risk and exposure and all that. The next thing I always discuss with clients is the details of the procedure, because not everyone knows what euthanasia is. And essentially, when we euthanize pets, what we're doing is we are anesthetizing them with an overdose. Okay? So the effect is always first that our pets are anesthetized. They're asleep as if they're ready for surgery. Because of the overdose of medication we give, very shortly their heart and lungs stop, and at that point they're gone. Now if you watch, after animals die, sometimes their bodies have reflexes. They may move a leg, they may chomp their jaws, sometimes their diaphragm will take a gasp. I'm confident, and I always ask my clients to share my confidence that this is not their pet experiencing agony, it's really just nerves and muscles unwinding. It is always sequential. First they're anesthetized, then their heart and lungs stop. Then we may see some motions of the body from nerves and muscles reflexly moving, but it's not a conscious response. Some clients want to be with their pet when we give the injections of sedative and anesthesia. Others don't want to be present, and I always give folks the option. Whatever is best for them to say goodbye is totally fine with me. After our pets pass away, I routinely have their bodies cremated. I personally know the veterinarian that runs the crematory service that we use, and so I'm confident that he's doing what he says he's doing. Some folks would like to have their pets' ashes returned, and private cremations can be arranged. Folks who are having a private cremation will sometimes choose to have the ashes returned in a simple plastic box because they're going to put them in the garden and plant a rose. Or some folks would like to have a nice chest, and the crematory offers those that sit on the shelf, and you've seen those, and there's some options that we have pictures of. And so that's the procedure. Once our client, we've had that conversation and they've made the decisions that they need to make about care of remains, I always ask permission to excuse the pet to the treatment area so that we can place an IV catheter, because these injections are given intravenously. And then we always gather back together, the doctor, the pet, and the client in the exam room, for those that want to be present, while we give them the injections for euthanasia. We give 2 injections. First is a tranquilizer to sedate them so that they're relaxed, and then we give the actual anesthesia in an overdose. Some folks ask, how long does it take? Interestingly, when pets have very poor circulation, it might take a little longer, because we're giving an injection in a peripheral vein and we're waiting for this drug to reach their brain. And so the sickest patients, sometimes it takes a little longer than the ones that are having the better cardiovascular performance. But even in that situation, this is a 2-minute, 4-minute procedure. It's really very quick, given the drugs at the dosages that we're giving. So that is what euthanasia looks like. It's very hard, and it's something that is part of our business. And so if at any point you guys are having trouble, concerns, it's an important part of what we do. But if it's a burden that you're finding that's hard to carry, talk to someone. Talk to your coworkers, talk to me, talk to one of the other doctors. One of the perspectives that was shared with me by a client that I really value, and it struck me as very odd at first, was he said, as we were euthanizing his kitty cat, he said, having a pet is like having a balloon mortgage on your house. And I thought, what the heck are you talking about? And he explained what he meant was, you get to enjoy this relationship for years and years and years, but at the end there's this great price that you pay. And I thought, wow, I wouldn't have thought of that. But it's an accurate, sort of analogy of what it is when we have to say goodbye to these beloved friends. So anyway, that's what we do that relates to euthanasia here at Marina Hills.